Hello, everybody. Hello. Is everybody hearing me? If you're hearing me, please put on the chat, yeah or yes. I'm going to start by exactly 4 p.m. That's 4 p.m. German time, 3 p.m. Nigerian time. That is in 3 minutes. So I'm going to wait for about 3 minutes and let's see if some other people will join so that we can start. Settings. Relation. Hello. Hello, I hope you're hearing me. Hello, if you're hearing me, please say yes. Put on the chat. So, welcome. My name is Enorita James. I'm a clinical research scientist. I have worked as a medical lab scientist in Nigeria for several years, and I now work as a research scientist in Germany. So today I want to talk about the kind of tests you need to do to be able to access your sugar levels. According to WHO, a lot of people are being diagnosed of diabetes every year. The number keeps increasing. And the reason is that a lot of people are not really proactive when it comes to their health, especially in checking their sugar levels. A lot of diabetic cases can be stopped and can be prevented if people are proactive enough to walk into the clinics or walk into a standard lab and ask for a test. The most common test that most people are aware of is the fasting blood sugar test. This is a test that almost everybody knows about, that this is a test that you can use to actually know if you have a high sugar or if you are diabetic. Fasting blood sugar is the most common test that a lot of doctors actually use to diagnose blood sugar. But I'm here to come and open your eyes to some other tests that are much more accurate than this fasting blood sugar. Fasting blood sugar is good. If you are watching me and you do not know what fasting blood sugar is, fasting blood sugar is a test that is normally done with the blood. Sometimes you can do it at home by using what is called a glucometer, where you have to just do a needle prick and then use the glucometer strip to be able to read your sugar concentration. You can also do it in the hospital, where a blood is taken from your vein and then they run a test on a part of the blood that is called the plasma, and then they check for your glucose concentration. Most times, the reason that it is called a fasting blood sugar test is because before the test, you are advised by the medical personnel the day before to have your last meal at about 8 p.m. and then be in the clinic at about 8 a.m. the next day. That means you must have fasted for about 12 hours before your blood sample is collected for this fasting blood sugar test. And the result will actually let the doctor know whether you are pre-diabetic, whether you have a normal sugar, or whether you are diabetic. But the problem with a fasting blood sugar is you fasted for 12 hours. So your body had enough time for your insulin to actually push the sugars into your cells. That is the problem with a fasting blood sugar. It doesn't exactly tell you if you have an active insulin. If you do not know what insulin is a hormone that is produced by one of our organs called the pancreas. In fact, the cells in the pancreas that produce this hormone are called beta cells. They are responsible for producing insulin. What is the work of insulin? Insulin pushes sugar into your cells. After you've had a meal, especially a carbohydrate meal, your body digests this meal and the end product is glucose. Once there's a spike of glucose in your system, it's a signal for the pancreas to produce this hormone called insulin to be able to push the sugar into your cells to make you have energy. So that is how the whole thing works. That is the work of insulin. But the sad thing is that diabetes, a lot of physicians, a lot of medical personnel focus so much on the sugar rather than on the insulin. If you don't know before, there are two types of diabetes. You have type 1 and you have type 2. And the reason this is divided into type 1 and type 2 has to do with insulin, not with sugar. But for many years in the medical world, sugar has always been what is being tested and what is being used to say whether you are diabetic or whether you're pre-diabetic. So that is essentially the challenge with fasting blood sugar. It does not exactly tell you the state of your insulin. But it's good to know that you need to do a test to assess your sugar level is very important. It can save you many years of being on treatment, because if you can be checking your sugar at least quarterly, you'll be able to know when it begins to go beyond the normal range into a range that is called pre-diabetic, a range that is not too high, but it is higher than normal. So that is a pre-diabetic state. And a fasting blood sugar can show whether you are in a pre-diabetic state, whether you have a normal sugar or whether you have diabetes. But there are other more tests that I want to make you aware of. Sometimes you can go to your doctors to see your doctor, and your doctor will write, depends on what you complain. If he's suspecting that it's something that might do with diabetes, he might send you for a test called HbA1c together with the fasting blood sugar. HbA1c is a test that actually tells you how your body has managed sugar for the past 3 months. It doesn't exactly measure sugar. It measures the percentage of your hemoglobin that is attached to glucose. The HB there stands for hemoglobin. If you don't know what hemoglobin is a protein that is inside your red cells that carries oxygen around your body. When there's a lot of sugar in your system, it attaches itself to this hemoglobin. And so the percentage of this hemoglobin that is attached to glucose will help the doctor to know how your body has managed sugar for the past 3 months. So that essentially is the HbA1c test. So if you go on and your doctor writes that for you, do not be surprised. That is why I'm doing this video, for enlightenment, so that you know exactly what that is. You know what the doctor is trying to find out. But the trouble or the problem with HbA1c is that other factors, other underlying diseases can actually affect its result. So you cannot actually use it as a means of a good assessment of your sugar level. It's better you do a fasting blood sugar, because with HbA1c, several things can affect it, since it has to do with your hemoglobin. That means if you have any kind of diseases that affect your hemoglobin, it can affect the result. For instance, if you have something like iron deficient anemia, iron deficient anemia can cause your HbA1c to be abnormally high. It doesn't mean that you had a high sugar for the past 3 months. It simply means that because the number of hemoglobin present is small, so more sugar is attached to it, irrespective of the concentration of the sugar. So if you have something like iron deficient anemia, you can have a high HbA1c. If you have something like hemolytic anemia, that is anemia caused by breaking down of your red blood cells. And this situation can be caused by several factors. It can even be caused by liver disease. It can be caused by drugs. For instance, even the common malaria drug. The way the common malaria drug works is to break down your red blood cells to get into the malaria parasites that actually enters into your red blood cells and sits there and begins to cause problems. So if you just took such a drug, if you just took an anti-malaria drug, definitely your HB level will be low. And once your HB level is low, you can have a low HbA1c result. So you can see that the HbA1c result or test is not really, I wouldn't say is a very good assessment of your sugar level. Fasting blood sugar is even better. If you actually want to assess your sugar concentration, fasting blood sugar is much better than that. Another test that you can look at, or your doctor can request you to do, is what is known as the OGTT test. I don't know how many of you have had that kind of test before, or how many of you have gone to a doctor and a doctor has written that you should go and do an OGTT test. The OGTT stands for oral glucose tolerance test. So the O is for oral, the G is for glucose, the T is for tolerance, and the second T is for test. So when the doctor says go and do an OGTT test, that is exactly what he wants you to do. And as the name is OGTT, it simply means they want to test and see how your body can tolerate a load of glucose. Normally, they tell you to come fasting. And once you get to the clinic, a fasting blood sample is collected from you. A fasting urine sample is collected from you. And then you're given a 75-gram glucose load in water. And you're told to sip it gradually or gently between 30 minutes or so. And once you finish sipping it, your blood samples are going to be collected every 30 minutes for 2 or 2.5 hours. And your urine sample is going to be collected every hour. Or every 30 minutes too, your urine samples are going to be collected. It is normally assumed that by 2.5 hours after you've taken this glucose load, it is normally assumed that your glucose or your sugar sample is supposed to have gone back to the normal level of your fasting level. That is, for instance, if you had a fasting level of about 80 milligrams per dl of sugar or glucose, normally your body is supposed to ensure that all the glucose you have taken in through this drink should be pushed into your cells. By 2.5 hours, you're supposed to have a glucose level at least between 80 and 100, not more than 100. It's supposed to go back towards the fasting sugar level. Most times, this test is normally done for pregnant women, especially in their first trimester. And it's normally used to find out if a woman will be prone to what is known as gestational diabetes. That is diabetes that is not really diabetes, but is diabetes caused by pregnancy. That means the person is not diabetic. It is only because of the pregnancy and the different hormone changes in the person's body that is causing this kind of diabetic state. So that is the OGTT. And most times, OGTT is also done to actually check if somebody is actually diabetic. especially if they do a blood sugar once or twice and it is on the high normal, but it's not exactly high enough for the doctor to diagnose you as being diabetic. So most times they ask you, if you do a fasting blood sugar and they notice that your blood sugar is a little bit above, maybe towards 95 or 105, something like that, the doctor most probably might send you for an OGTT test to actually see how your insulin is going to handle this glucose load. But the problem with the OGTT test is that you're just given a glucose load. It is not the same with eating food. Because when you eat food, a lot of factors come to play in digesting your food and in breaking it down to form the glucose. So that's essentially a problem with OGTT. OGTT, for me, you cannot really use it to assess and see if somebody has diabetics or not. So now I've mentioned 3 tests that a doctor might send you to. The first one is the fasting blood sugar test, which is okay, which is the general test that a lot of physicians, a lot of laboratories do to actually check your sugar in combination with a fasting urine to actually check if you have sugar in your urine. And I've talked about the HbA1c test. I've told you why it is done. And one other thing I need to add when it comes to HbA1c, HbA1c test is best used to monitor treatment because it actually checks your sugar level for the past 3 months. So if you're diabetic and you're on any kind of treatment, this can actually help to monitor to see whether what you're being placed on is actually working, whether your sugar is being regulated, whether your sugar is actually being pushed into the cells, whether your insulin is working. So most times HbA1c is better used as a treatment monitoring test rather than a sugar assessment test. So next time that your doctor sends you for an HbA1c, so you know that you've listened to me and you know what it is all about. So now let me now come down to the actual test that I think is best for assessing your blood sugar. And this test is the 2 hours PP test. What is the 2 hours PP test? 2 hours PP stands for 2 hours postprandial test. That is 2 hours post-meal test. That is what it stands for. How is this test carried out? You are normally told to fast and have your last meal at about 7:38 the day before. And then the next day at around 8, your blood sample will be collected for a fasting blood sugar test. And then you'll be told to go and eat. And you'll be told to eat something that you normally eat. If you normally eat eba or rice or plantain, whatever food you know is a regular food for you, you'll be asked to eat that kind of meal. Don't go and eat something fantastic or something, different from what is your routine kind of food. So once you eat this food, and immediately you finish eating, you start timing yourself. Let's say you finish eating this food at around 10 a.m. You time yourself for 2 hours after you finish eating. You now go back to the lab or the hospital and they'll collect your sample again to check your 2 hours PP sugar level. This is the best way to actually access how your body handles sugar. This is the best thing that can actually tell if you have a high sugar or not. So that for me is the best test that you can do to assess your sugar level, to actually know whether you have a normal sugar concentration or whether you have a pre-diabetic sugar concentration or you're actually diabetic. Because your system now has normal food that you eat, routine food that you eat, and it actually shows how your system can manage the sugar in your normal meal. So that is how good this particular test is. So if you're going to your doctor, now that you're informed, and your doctor wants to send you for a fasting blood sugar, insist that you want to do a 2 hours PP, because that will be the best thing that will let you actually know immediately whether you should start working on yourself in terms of your sugar concentrations, whether you start watching what you eat. Because the most important thing about this 2 hours PP is that if, for instance, you have a fasting sugar of 80 milligrams per day, then after the 2 hours, you now have a fasting sugar of about 90 milligrams per day. That is okay. But let's say you had a fasting of 80 milligrams per day, and then after 2 hours of eating, you now have a fasting sugar of 105 milligrams per day. That is a pre-diabetic state. Incidentally, I've not told you the normal ranges for sugar. Normal range for sugar is about 70 to 9,500. In fact, 70 to 90 is best, but 70 to 100 is acceptable as the normal range for sugar in milligrams per day. Sometimes you can have your result in what is called the SI unit, that is millimoles per liter. That is SI unit. If you want to convert your sugar level to millimoles per liter, just divide the value by 18. Once you divide the value by 18, it gives you millimoles per liter. So that is what the normal range is like. So anything above 100 to 110 milligrams per day is pre-diabetic. That means you're on the verge of becoming a diabetic. And it is at this stage that you can actually work on the sugar with diet and maybe natural supplements that can regulate your sugar. The sad thing is that a lot of people in the world today are pre-diabetic. And the saddest thing about that is that they are not even aware. They are not aware. If people become aware that they are pre-diabetic, a lot of people will be saved from becoming diabetic. Because you don't just become diabetic suddenly. Diabetes is due to many years of accumulation of sugar in your system, many years that you've been taking high carbohydrate diet. And because you've been taking this high carbohydrate diet and your system continues to digest this carbohydrate, and the end result is a lot of glucose in your system, your insulin becomes overworked. And when your insulin is overworked, you find out that your insulin does not have any kind of effect on your cells anymore. That is what that term comes. That is when you have this term that is normally called insulin resistance. A lot of people have insulin resistance. But the sad thing is that when they do a fasting blood sugar, the sugar is still normal. So that brings me to the last test, an insulin test. You see my problem, I'm in the medical field, but the challenge is that we focus so much on the fasting blood sugar, which for me is a symptom of diabetes and not the root. The root is insulin. That is why when diabetes is divided into two kinds, it has nothing to do with the sugar that you have. Type 1 and type 2 diabetes is called so because of the nature of the insulin. Insulin is the root cause of diabetes. When insulin is not functioning, that is when you have this diabetes. If you do not know, if you might want to know what is the difference between the type 1 and the type 2. Type 1 diabetes is diabetes that has to do with genetics. That is why most people that have type 1 diabetes are children. It's a genetic thing where the pancreas is not producing insulin, or the pancreas is producing insulin that is not working, or the beta cells that produce the insulin is not working, or it's not even there. So it's called type 1 diabetes. So when such an individual takes in anything carbohydrates or anything that has to do with sugar, there is no insulin to push in this sugar into the cells. So they have a lot of glucose running in the system. Type 2 diabetes, on the other hand, has to do with nutrition. It has to do with the fact that you have saturated yourself with carbohydrate food for so many years, and your insulin has overworked itself so that it reaches a stage where the insulin is no longer being recognized by the cells. And when this happens, the cells will send a signal to the pancreas to produce more insulin, without knowing that the insulin is already in the system, but it's not having an effect on the cells, causing the glucose to be pushed into the cells. So you end up having hyperinsulin. And the amazing thing is that when you have this high insulin, most times your sugar is still normal. So that is why I said a fasting blood sugar does not really tell you your state. The best thing that can tell you your state is 2 hours postprandial blood sugar and an insulin test. Because when you do an insulin test and you see that your insulin is high, especially your fasting insulin, if you see that it is high, you can begin to work on it. Even something as common as exercise and intermittent fasting can reduce your insulin. Isn't that better than waiting until you become diabetic and then you start being dependent on diabetic drugs for life? In my channel, I talk about preventive health. And this video is for information because I've worked in the lab for over 20 years and now I'm working in research. So I'm giving you information that you might not know. And my advice to you, if you are watching this video, is to ask yourself, when did you last do a sugar test? When did you last go to your physician to check yourself? Not just for sugar tests, every other test. Most times we wait until we are sick before we visit the hospitals. To be able to have a preventive health, it is best you visit your hospital and ensure that you ask your doctor that you want to check your sugar. You want to assess your sugar in your system. Since it is this is the primary cause of a long-term disease, it is better you check it and start working on it so that you will not enter into a stage or a state of depending on medications for the rest of your life. I hope you've gotten one or two things from this video. And if you're watching me and you have any question, please don't hesitate to drop your questions. As I said, in my channel, you find a lot that has to do with preventive health, that has to do with vitamins and supplements. I hope you enjoyed this video. In my next video, I'm going to be talking about certain kinds of food that you can actually eat that will help you reduce or regulate your sugar. I'll talk about the food you can eat that will help you regulate your sugar, so that especially if you've done this test and you've discovered that your sugar is on the high normal, there are a lot of food out there, just that information is the problem, ability to know the kind of food to eat. There are lots of African food that you can actually eat that can regulate your sugar, a lot. And I'm also going to show you how you can cook it, so that it can work well for you, especially if you notice that your sugar is a little bit on the high side. So I'm waiting for questions. If you have any question to ask, feel free to ask. So if there are no questions, I think I will bring this to an end, and I hope that you enjoyed yourself. If you have any question, you can always ask it later. I will get back to you as soon as possible. Thank you so much for watching. See you in my next video.